Well, hello and welcome to Ask the Doctor. My name is Jerry McGee and I'll be your host for today's show. We're here in Pittsburgh, Pennsylvania at Wellness Associates with Dr. Eugene Goldberg. Dr. Goldberg, thanks for your time today. We always enjoy coming down and kind of picking your brain on some different things of interest to our viewers. On today's show, we actually had a person that wrote in about, she's a pregnant female, was going to a chiropractor prior to getting pregnant, working on maintenance and just kind of, she had some issues, so she enjoyed going to a chiropractor. She became pregnant and the OBGYN said, stop any chiropractic care until after the pregnancy. What would you say to, she wants to know, can she, continue chiropractic care in a safe and effective manner?
My answer is that's ridiculous, because if she's having low back pain, which a lot of pregnant women do, chiropractic is the first line of defense, okay? Now in their third trimester, they may not be able to lay face down. That's okay, we can adjust them on their back, we can adjust them standing, we can adjust them sitting. Think of this as the pelvis, Jerry. Guess what, if your pelvis is out of alignment, the baby's head can't come through. So to me, chiropractic is an essential thing for a healthy pregnancy, okay? Especially if they're having back pain. So really it's two reasons. Number one, we help their back pain. Number two, we help the delivery because the baby's head goes right through the pelvis. Put your hand through there. And if the baby's pelvis is out of alignment, you see how it puts pressure on the head? Why get a C-section when you can get a chiropractic adjustment? Makes sense to me.
Yeah. Now let's take this even to the next level, because we're talking about pregnancy now, and let's go beyond that now. We had the patient who was pregnant.
Right.
Now we have the baby.
Right.
Okay, because I know there's a lot of, in doing some research for this show, I was looking at people adjusting infants.
Right.
So, because childbirth is not a very, it has a toll on the baby.
Especially if they're using forceps,
Right.
okay? So forceps delivery, my understanding, puts a tremendous amount of stress on the neck. So therefore, if you have stress on the neck, that means you need chiropractic. You need to get the neck adjusted as a proactive thing to prevent, let's say, future problems.
So even, I guess one of the questions also would be then, you're never really too young for chiropractic care.
I've adjusted people, Jerry, 2 weeks old, a little
Okay.
2-week-old baby. See, the only people that you get adjusted, in my opinion, Jerry, are the people that have spines, okay? And yeah, it's fun. But see, like, you know how you brush your teeth? What we do is we brush your spine, okay? So, of course, you say you don't brush your teeth fall out. It's the same with your spine. Your spine needs an ongoing attention. Why? Because you live your life through your nervous system. So your brain and your spinal cord, if there's pressure on the brain and the spinal cord, that can affect that cell, that organ, that muscle. It affects your immune system. See, to me, Jerry, the healthiest kids are the chiropractic kids, okay? And the reason that is because your nervous system's actually wired to your immune system. So when you get an adjustment, you raise your immune system 400%. So if you're sick, or you may not even get sick, the healthiest kids are the chiropractic kids. If they get sick, they're only sick for half a day. I know a lot of chiropractic kids, they don't even get immunization shots, and they're perfectly healthy. See, if you're healthy, germs can't bother you. That's why Louis Pasteur on his deathbed said germs are nothing. What he meant is the environment you put the germs. So if you have a healthy environment, you have a good lifestyle, good diet, good nutrition, good structure, you don't need the shots. Look at the Amish. They don't get shots. Chiropractic kids, they don't get shots. See, in science, the exception ends the rule. And what that means, if there's people on this planet that aren't getting shots, that are perfectly healthy, that means you don't need the shots.
Now let's, one of the things that I just thought of as we were going through this pregnancy to the infant, I know about a week ago I was watching a news program, and they were talking about kids going back to school with these backpacks, lugging all this weight around. So, when you take a look at that student who's maybe complaining about some pressure, we know adjusting the backpack is the right thing to do, but there could already be damage done and things that need to be kind of realigned. So what would you say to that parent that's watching this show right now about, having that child come in, take a look at their, alignment and see what you can do?
You get your teeth checked every 6 months, get your spine checked every 6 months. If you have a backpack on your back, that's going to put pressure on your spine. That's going to push you forward, okay? It's going to cause what is called maybe anterior dorsals, where all your vertebrae in your mid-back, upper back are pushed forward. That can press on the spine. That can affect your lungs. A lot of kids come in, they have asthma. We can help asthma. A lot of it relates to anterior dorsals because the spine's pushing forward. It's pressing on the organs, the lung, okay? That can affect their neck. It pushes the neck forward. We can adjust their neck. So you get your spine checked every 6 months. Like you get your teeth checked every 6 months. Does that make sense to you, Jerry?
Yeah. And even going to the next level, because I know when I was younger, I was big into athletics and football and all that. And, so if you got a parent watching right now and their son's playing football or a contact sport, and they're out there getting banged around. And the reason I bring this up is because I know when everybody knows the story of how I went to a chiropractor for my knee, but when I was there for that, he looked at all the other areas and he noticed that my neck, because of course with tackling and all those types of things, needed some work done. So, even if a person has a child right now in sports without really having any major problem right now, it makes a whole lot of sense to come in here and have some preventative work done, checking that alignment and make a difference.
People don't realize, Jerry, that when you get an adjustment, yeah, you're helping the pain, but you're helping your functioning and performance. That's why the night before the Super Bowl, I know the Steelers chiropractor, the night before the Super Bowl, all the Steelers Saturday night got adjusted. Why? They weren't in any pain. They just wanted to help the next day's functioning and performance. Why? Because the nervous system controls that cell, that organ, that muscle. You live your life through your nervous system. So therefore, when you get a tune-up the night before the big game, yeah, that helps your pain, but it helps your functioning and your performance. All major athletes, I know Barry Bonds, he's real big on chiropractic, okay? The person that won the Monte Carlo on the bike, okay? It's his name? I forget his name.
Lance Armstrong.
Yeah, he's real big on chiropractic. In fact, a chiropractor travels with him when he's on the tour, okay?
Right.
So all the major athletes all get chiropractic. Well, yeah, it helps their pain, but helps their functioning and your performance.
So, if you're watching this show today, we want you to understand that chiropractic care, one, is for any age, from infant on. There's definite benefits to it. Preventative medicine, looking at keeping your body functioning at a very efficient manner. So you don't have to have a problem to really come in for chiropractic care. I think it's good to get your body checked out, get the alignment checked out, make sure your function is proper. So if you have a person, or you got a child that's in sports, athletics, and you're really looking to optimize their athletic performance, give the office a call. Call Dr. Goldberg here at Wellness Associates. Come down. He offers a free evaluation, which will allow you to kind of get to meet Dr. Goldberg and see what he's all about here at Wellness Associates. Let him tell you firsthand what he can do. And I think you'll be amazed at, one, the information that you're going to receive and the knowledge that he brings to the table and how he can impact your overall health. So, with that, we just, really thank you for watching our show today. We hope you find this information to be informative and enlightening, because an informed consumer can make a great decision. So, that's what we're all about, is educating the public on the benefits of chiropractic care. And if there's anything at all that Dr. Goldberg can do here at Wellness Associates, pick up the phone, give his office a call. Got a great staff out here that can address your insurance questions, any of those questions you have, and come down for one of his free evaluations and see what he can do to really impact your health. So thank you very much for watching this episode, and we look forward to seeing everybody on future shows.